Please welcome Henner Farin, German Cancer Consortium, Frankfurt. Patient-derived tumour organoids as a preclinical model for cell-based immunotherapies.
Thanks a lot for the great possibility to showcase the work of my laboratory here. We are interested in colorectal cancer, still very deadly disease, and sequencing of large cohorts of patients has not yet led to better prognosis and prediction of therapy responses, while the mutation-rich hypermutated tumors we have now the availability of immune checkpoint therapies for the bulk of tumors with low mutation burden. This is still not accessible. We are developing patient-derived organoid models as functional cell models in order to serve as patient avatars that we can use to have a better linkage of genotype and phenotype and test new treatment strategies. We have heard today about CAR therapy. This is, as we've heard, very beneficial for liquid malignancies, for solid cancers, as we've heard. There's still a lot of research to be done. We have really not understood which tumor antigens we have to target. There's considerable off-tumor toxicity and the problem of tumor cell recruitment and immunosuppression in the cancer microenvironment. For this purpose, we set out to set up a organoid-based preclinical model where we use universal CAR and NK cells. And here's a video microscopy where we basically treat green cancer cells and normal organoids, and the CAR NK cells selectively eradicate these tumors. So I think we have here the first 3D setup to test such strategies. And can I get the next slide? Yeah. By this, we would be able to test, for example, different functionalized CAR molecules in a preclinical setting to identify possible antigens and increase efficacy and safety. However, we're also interested to use this model now to study the problems that come along with solid cancer CAR therapies. Yeah, and last but not least, I'd like to acknowledge my laboratory and the clinical collaboration, especially with Winfried Welz, who has offered us this great project collaboration. And you.